What's up, YouTube family? Welcome to my channel, The Ready Nursing Aide. Today's video, we're going to be talking about the coolest unit I have worked on as a nursing student. So it's a little story time video. So grab your little tea, your coffee, your water, whatever it is that you drink, and let's talk about this cool unit I worked on. So if you don't know, I am in my last semester of nursing school. I graduate in 2 months and I'm going to be out this thing. So I'm basically doing a series of story time and just different things I've learned throughout school to share as insight with those who are interested or maybe going to nursing school and they're wondering about certain things and topics. So coolest unit I worked on as a nursing student, no doubt, was OR. OR was the coolest unit I had worked on, and then I would say ER was kind of like a far second as a nursing student. Okay, so number one, OR was definitely the coolest unit I worked on because I think the idea and the actual practice of surgery on the human body is so cool to me. It's so cool to me. I grew up watching ER. I think that was in like what, the 90s, 80s, whatever. I grew up watching ER. If you don't know what that is, for all my youngins, go Google ER 1990s ER, okay, and go watch the episodes. It's better than Grey's Anatomy. And I said what I said. But I grew up watching ER, and then by the time Grey's Anatomy came out, I was older, like I was like a young adult. So, but I watched Grey's Anatomy too for a little bit. All of the doctor shows, all of the emergency medicine type shows, I would watch those, and I enjoyed them. And even still now, watch Botched, anything dealing with surgery, I thought that was so cool. So for our nursing clinical, we actually were able to like sit in surgeries and go with the OR nurse, spend time with the OR nurse in a surgery, and actually go with the pre-op and post-op nurses and the PACU nurses, all this stuff kind of around surgery. I thought that was the coolest thing ever. And in my clinical group during my surgery rotation, like I got to watch robotic surgeries. So like I'm having a brain form, but anyway, robotic surgeries like the gastric bypass and the gastric sleeve, I got to watch those. And like I said, it's pretty cool. The OR is a very sterile environment. It's like literally a big plain room. There's literally an operating table, and because I was in a robotic surgery, you got this huge robotic machine. And then you have your surgical tech that's in the sterile field with all of these different gadgets. It looks like fingers that's connected to this robotic machine, and the fingers are literally inside the patient doing what the doctor is controlling. And the doctor is sitting behind, like, there are 2 doctors in there sitting behind like what looks like an astronaut pod or something, and they're controlling the robot. And I thought that was the coolest thing. And they have this they had a big old huge screen TV on the wall, and the camera, I could see, and the nurse could see what the camera was doing, like what the stuff was doing, and you could see it on the wall. So like you're literally looking and literally watching the I'm gonna say the fingers of the robot inside this patient's body. You could see like it's inside the abdomen. You can see the intestines, you can see the stomach, and it's clipping and snipping and stapling and then burning and stuff. I thought that was the coolest thing ever. The cool thing about robotic surgery, well, the ones I was in, like, it didn't have any smells or anything. It was chill. They really do play music in the OR. So depending on who your doctor is, they really do play music. I think the music that this doctor had on was like kind of like soft country music, very chill. But they do play music, and then it's kind of weird too. I didn't realize they even joke with each other. So you have like the doctors were joking with each other, and then the doctor and the circulating nurse were joking with each other. The surgical tech, like, they knew each other really well, and so they were joking with each other. So I was like, oh, that's different. You know, like, we're literally in a surgery, like doing a surgery on somebody's body, you know, and their intestines and stuff and their stomach, like inside their body, and y'all were like joking about, like, you know, burning dinner last night, you know, joking about like who you going on a date with tomorrow. Like, so that was interesting, but I guess it takes the pressure off. It, you know, it keeps them awake and alert. I don't know, but that was different. But I liked it. You know, I liked being in there and seeing it. I thought it was really cool. I even saw their supply room. Their supply room is huge. It looked like a huge warehouse. I'm like, how on earth do you know where to go when you need something? You know, so I'm pretty sure all the nurses and stuff know, but like their supply room was bigger than any med room, any supply room I have ever seen, because they literally have supplies for all these different surgery rooms, you know, equipment and gadgets and different things. It was huge. Like it was huge, like a big warehouse. And there's multiple sides and multiple supply rooms for multiple things. And then even like them getting the patient ready for pre-op and post-op, setting the patient up, assessments, entering IVs, Foley's, or whatever the case may be. PACU, the post-anesthesia care unit, they're basically maintaining the airway, you know, watching their respiratory status, cardiac status as they're coming off the anesthesia, their alertness and things like that. Seeing the whole process of once the doctor finished the surgery, and them, you know, getting everything connected, getting everything sewed up and stitched up, and then the nurse, you know, they're moving the patient, getting the patient squared away, and then the nurse and the anesthesiologist roll the patient to PACU. So I think that was pretty cool to watch and witness the fullness. A few of my other classmates went to like a heart surgery, some orthopedic surgery, bones and stuff. They said with orthopedic surgery, you can definitely smell like when they're, you know, like bones and stuff, when they're rearranging. I'm making a sound effects, but you can hear all that and you can smell it when they're cauterizing and different things, which is, you know, you can hear all that, you can smell it. I'm trying to think what some other patients went to. I mean, other classmates went to different types of surgeries. So yeah, but that was cool. The ER, I wouldn't work in the ER because it's super fast, but as a nursing student, it was fun because I got to do all of my skills, my nursing skills in the ER, because you have so many different cases, and all of my classmates the same way. We all got to practice all of our nursing skills firsthand because you got all kinds of stuff coming in the ER. So IVs, you're able to do them. NG tubes, you're able to do those. IV catheters, you're able to do those. Assessments, wound change, you're able to do all these things in the ER. And it was cool because it was my first time seeing, you know, like they had the patient, an older person that came in there, they were intubated, put on a ventilator, but also they had a chest tube, doing a chest tube, seeing that. And sometimes the chest tubes that they do in the ER could be a little bit different than chest tubes they do on the floor, because in the ER everything is moving faster. So seeing them literally do all these things at one time, yeah. And then I think in the ER, because it's like a life or death situation, sometimes it's not as, you know, sterile, clean, perfect, like a lab setting for nursing school. So just, you know, or even during like on a med-surg unit, a unit where things are a little bit more stable, in the sense that in the ER where it's like life and death and you're making sure this patient stays alive. But it was cool as a nursing student to be able to do all my skills. I thought that was fun. Would I work there? Too crazy for me to work there, but it was cool. So those are the coolest units I've worked on. What are the coolest units that you guys have worked on as a nursing student? Drop them down in the comment section below. Like, comment, subscribe, and I will see y'all in the next video. Bye.